All right, so now we move into ankylosing spondylitis proper. So the things that would make us say, hey, maybe this is an ankylosing spondylitis room, an AS room, would be that one of these four would show up: forced tears, bowstring, chest expansion, Lewin supine, or Amos sign. Now, maybe you don't know some of these, so we're going to go over all these. I will tell you that bowstring, forced tears, bowing, you know, there's a bowstring test, there's a forced tears bowstring, there's nary bowing or bowing. So there's quite a few bows and bows and bowstrings out there. So let's make sure you've got the right things targeted with the right information. When we look at ankylosing spondylitis, realize it's an autoimmune disease. So it's a inflammatory arthritis, it's autoimmune disease, it's ankylosing spondylitis. So, you know, there's a lot of AKAs that would be appropriate for this. The one thing that probably now should be triggered in your mind based on our previous discussion is, really, we don't know, even if these are positive, whether or not the person has AS or enteropathic arthropathy. So probably the right questions to ask in this room are you having any diarrhea? Okay, so ask about that, or any breathing problems, because that'll help you confirm whether or not you're going into ankylosing spondylitis or enteropathic arthropathy. So that would be very key questions. So those are the key questions. Circle those. You might get asked what the labs are, so realize that you're doing the arthritis panel, HLA-B27. Now let's bring Ben in and talk about how to do forced tears, bowstring, and chest expansion. So Ben, welcome back. Now this time you're going to face the screen here, and what we're going to ask Ben to do is just to laterally bend. So Ben, I just want you to lean one way, okay, see, and lean the other way, and look at how easy Ben can do that. Now your job is that you should be palpating, and we'll find that this part of his back is kind of loose, but this musculature is very taut, holding him there like a taut rubber band. And when he contracts this, he's going to become upright. Now, if Ben had a poker spine here, this was fusing. Can you imagine this all fusing? If that was all one solid fusion, then you would have trouble trying to lean that way, right? You'd be struggling. So if he was struggling to lean that way, I would feel all of the spasm on the ipsilateral side of where he's laterally bending. That's forced tears, bowstring. It's that we're evaluating where the contractions are as his spine is fusing and becoming a stiff rod. Okay, now the next one is chest expansion. Alright, with chest expansion, when it gets into the costovertebral joints, it's hard to take a nice deep breath, okay? So his breathing will get more and more shallow as time progresses. Now the thing about chest expansion is, I want you to learn how to do this for both male and female, because they put both in this room, and if you do inappropriate touching with the female, they're kind of allowed to push you away and say, no, no, you know, stop. And if it gets pretty egregious, number one, you're going to fail. Number two, the examiner's going to be out there telling you to, you know, sit down. So that's the last thing you want to have happen during your test. So I'm going to show you how to do chest expansion on a female. Okay, so I want you to do it the same way for male and female. So once again, you're practicing, your behavior is just appropriate for either gender. Alright, so the chest expansion's done at T4 to T6, which is just about nipple level. But you do not say to a woman, hey, put this across your nipples. You don't say that. And then probably the best thing to do is to have the woman turn away from the examiner. So we're going to make you the examiners, and I'm simply going to say to her now and him that I want you to place this right in the middle of your chest. Now I'm going to do it wrong the first time to show you some of the things that can happen if you're kind of not thinking ahead. So what I want you to do, Ben, is put this right in the middle of your chest, okay, but I want you to kind of hold it like this, okay? Yeah, okay. Now, if you'll notice, I have an awful lot of extra here, and I could just about tie a bow up and make him a Christmas present, okay? So this is one thing we don't want to do, and can you imagine, I'm going to tell her to let go or him to let go. So Ben, you go ahead and let go. Okay, now, what will I do if they say, hey, we want to know your measurements? Well, I'd have to do an awful lot of higher math, or I would have to start sliding this, and nobody wants this slid across the nipple line, okay? Make perfect sense, everybody? Alright, so we're in a mess here. So let's start again, and let's think about what are the key things you have to consider. Alright, well this is a different color now because I had taken it all the way out to its end and then couldn't get it back in. So that's one thing you don't want to do either, is break the equipment. So one of the things that I want you mindful of is the fact that you just want enough here to get around the girth of that person so that you don't have extra back there. So kind of look at your person and look at their stature, look at their girth, and kind of see what you need. Okay, now the next thing you want to do is make this a little wider than narrower, because if they're holding a little spot like this, you're going to have to reach around and grab wherever it is. So make it wider, okay? So now let's try it again. Take two. Ben's going to hold that. Take a look at how good this is working out, huh? What do you think? Now, the next thing you have to do, and maybe you want to write these down piece by piece, is now you need to let go of that. Okay, so you have to tell your patient to let go of it, otherwise they're holding it the whole time, and you'll get marked down for that. Now, the next thing is the breathing instructions. Okay, so let's talk about this. We have to get a full breath of air, and then a full emptying of air, right? Inspiration, expiration, full inspiration, full expiration. How do you get full expiration? And if you think about it, if you're just sitting there in your chair right now, and I told you, just breathe out all your air out, just, from a normal breath, you can't do it very well, but watch. Take a full breath of air in. Do it with me. Now blow all your air out. Now you can really expire. That's how you get full expiration. So that's usually what we start with. Okay, so full breath of air in. Nice breath of air. Now blow all your air out, and that gives us expiration. Now we mark that. Now take a full breath of air in, and he does that, and we mark inspiration. So now we have the two marked on our sheet, or on our tape measure, and we can now tell the examiner if asked for that. Because what they'll want are the actual measurements. Now, sometimes they've even asked for you to just tell them what normal is, which is 1 inch to 1.5 inches for women and 1.5 inches to 2 inches for men. If you say about 1.5 inches, then you're probably going to be pretty close to right and get your points. But if they want the exact measurements, make sure you've done this properly and shown that you know how to do it. Thank you. All right, now if you need to rewatch that again, watch that again, try this a couple of times because this is tricky. And I forgot to tell you one more thing. At the end of all of this, we've told them to take a big breath of air in, blow it all out, then take a big breath of air in, then we measured it. Then what's a really important thing to tell our patient? Breathe. Okay, so you've got to tell your patient to breathe again because they've been told that if you don't tell them to breathe again, they can hold their breath, hold their breath, hold their breath, and then fall in a clump on the floor. And then I don't think you want that, okay? All right, now we're moving into Lewin supine and Amos sign. Now, Lewin supine is consider the fact that ankylosing spondylitis and enteropathic arthropathy usually occur kind of early in your life and kind of get started and then hound you the rest of your life. And so what you want to do is keep the progression of it down and slow, and that's why you want to make good choices and stay away from stress and think about dietary things with enteropathic and think about mobility things with both of these. So let's consider then that we have a young person, maybe a bag boy at the grocery store or something, and you have a conversation with them, they tell you how stiff their back is and that they're an athlete and they're so active, and it's just, in the mornings they're so stiff, and so hey, you bring them into your office, you do an evaluation, and you do Lewin supine. Now, don't you expect this young, healthy athlete, bag boy, at the grocery store to do a sit-up? Well, sure you do. So you put them in this flat position, you hold their feet and say, try to do a sit-up, and they go, oh, I can't. No, I can't. Try to do a sit-up. Oh, I can't. Okay, all right, so our able-bodied Ben here can, but realize then that he doesn't have AS, okay? His SI joints are not fusing. But if a person's having difficulty doing that, and then we're considering the fact that they could have AS or enteropathic, and at that point it's important to ask about, are they having any diarrhea or things like that? Because probably if it's enteropathic, that's showing up by now. Maybe not the breathing problems of AS yet, but that'll be around the future, so that'll be our consideration later on. Now, the next thing, let's consider that Ben had just come from the standing position. So Ben, I want you to sit up and kind of face this way, swing your legs over this. Let's say that we had just got done doing chest expansion, and they said do Amos sign. And this patient is acting stiff, okay, kind of sore. So I'm going to help Ben lay down. Oh, stiff old Ben, we're going to get him laying down. Oh, he's having so much trouble. Okay, so we get him in this position. Then his job is to show me, with this stiffness in his back, how difficult it is for him to get out of bed in the morning. So now I watch, after he's in the supine position, I watch the protocols he has to go through to get out of bed. So maybe he kind of rolls his body over to the side and throws this leg over, and he probably pushes up with his hands, and you want to see how he works it to get up. So that's called Amos sign. Alright, so with Amos sign then, if you've just done something standing and then they have Amos sign there, what you'll want to do is help this patient that's being real stiff. Okay, you want to help them kind of lay down, and you'll help them get their leg up and get them back. Then what you do is you say, okay, now let's say you're on the Davenport or you're on the bed in the morning. What do you have to do to try to get up? So then you look at the mechanics of them maybe throwing their leg over or pushing up with their hands, and so they're going to show you how difficult it is for them to get up because of this stiffness.